Augmented reality isn't new. It provides an engaging atmosphere for students so that they can practice high-risk situations in a low-risk setting.
For me as an educator, it's the ability that you had to drive home the learning objectives.
These games bring the patient to life.
Augmented reality is adding reality, something that's not in a situation, to make it more real. So on a football field, when they put the down line down, it is augmented reality. So our digital natives today are used to that environment.
So you want to hold that up and center it over?
You know, simulation is already an emotional environment for our students, and some of that emotion comes from the fact that they have to pretend about certain things. They have to pretend about what the leg might look like if there's a wound on it. Or they might have to pretend about how a patient actually looks, whether they're sweating, whether they're blue from their cyanosis, or whether they're bleeding from a certain spot. The augmented reality brings realism into it, so they don't have to pretend as much, and it takes that anxiety away from them and allows them to be more emotionally involved with the patient in the simulated environment.
I came in here with a little scratch and now I'm sick. No grown man should have to have nurses clean him up. It's not right.
It just seems cleaner and less use of their imagination and just the ability to make it more real.
Gaming is just another way to practice and give them more time at home to learn more about the material and think about how they would react in a situation.
When a student gets into the game, they have the videos there of the patient and they're allowed to interact with them in a low stress environment. They're allowed to repeat those videos over and over again and get immediate feedback and making sure that their answers are the answer that we'd like to see in the clinical environment before they actually get to clinicals.
By participating in the game, they should be better prepared when they are actually in simulation with what they would say to the patient.
Oftentimes in clinical and in simulation, we work with 1, 2, maybe 6 students, and it's pre-planned a little, but not as fine-tuned as this can be. So augmented reality gives us the ability to do that. It's really endless if you think about it.